Welcome to Community Health Matters. I'm your host, Kristen Presall. On our show today, while making the choice to live healthier can be difficult, Healthier Tennessee is dedicated to encouraging Tennesseans to live healthier lives. Rick Johnson from the Governor's Foundation for Health and Wellness joins us to talk about Healthier Tennessee and the small steps that you can take that add up to a healthier life. Obesity is a growing issue in America and Tennessee alike, and a healthy lifestyle is the first step in combating the problem. Diabetes educator Sarah Neil Pilkinton from Williamson Medical Center joins us to share some nutritious guidelines and lifestyle choices. We all know that healthy living begins at home. Dr. Brent Coil, family medicine physician from Nashville Medical Group, is here to discuss cold and flu season and ways to stay healthy this year. All of that coming up next on Community Health Matters. Did you know getting a good night's sleep plays a vital role in good health and well-being throughout your life? According to the National Institutes of Health, sleep is essential to helping your brain work properly. It helps enhance your learning, problem-solving skills, and creativity. Sleep is also involved in healing and repairing your heart and blood vessels to help guard against heart disease, kidney disease, high blood pressure, diabetes, and stroke. The National Institute of Health recommends at least 10 hours of sleep a day for school-age children, 9 to 10 hours for teens, and 7 to 8 hours for adults. Did you know Tennessee has one of the highest rates of smoking in the country? Nearly 25% of Tennessee adults smoke cigarettes, according to data from United Health Foundation's America's Health Rankings. Fortunately, research shows that quitting smoking has both immediate and long-term health benefits. According to the American Lung Association, just weeks after quitting, your lung function begins to improve and the risk of heart attack begins to drop. 1 year after quitting, your risk of coronary heart disease is half that of a smoker. And within 5 to 15 years, your risk of having a stroke or getting mouth, throat, or esophageal cancer is half that of a smoker's. Joining us now is Mr. Rick Johnson, President and CEO from the Governor's Foundation for Health and Wellness. Thank you so much for your time today.
Thank you for having me. It's great to be here.
A lot of people know this foundation by, we should probably say maybe a different name or the initiative itself, which is Healthier Tennessee.
Yes.
But for those folks who aren't familiar with this, Mr. Johnson, would you please kind of just tell them what the foundation is all about, please?
Happy to. The foundation was created by the governor last year in 2013. It is a 501c3 not-for-profit corporation funded primarily from the private sector with some money from state government. And its purpose is to make Tennessee a healthier state, to make this a healthier place to live. It's one of the greatest states in the country. Some would say the greatest state in the country. But unfortunately, it's also one of the least healthy states in the country. Has ranked in the bottom 10 compared to other states for the last 20 years. So our mission is to try to enable and encourage Tennesseans to lead healthier lives and to get this great state out of the bottom 10.
Would you say those statistics were a big motivator to create this kind of program?
They were, because we just can't accept the status quo anymore. There's some really sobering statistics that are really bad news, and I have to share a little bad news before we talk about the good news and what we can do about this. As I said, we've ranked in the bottom 10 for 2 decades, never any better than 42nd, as worse as 48th out of 50th. About 1 in 4 adults in Tennessee in self-reported surveys say they smoke. Worse than that, 1 in 5 teenagers in Tennessee smokes. We have about 35% of the population, more than a third, saying we get no physical activity at all in our lives, so we're one of the most sedentary states in the country. And between people who are rated or classified as obese and overweight, almost 70% of us fall in one of those categories. So as a result of all that, we have really high rates of cardiovascular disease and type 2 diabetes and COPD and asthma, and these are all, and hypertension and stroke. And these are all behavior-related chronic diseases, really terrible to have, painful to have, difficult to live with, and they're preventable.
Sure.
They're based largely on the way we live. So what's that costing us? Why is that so bad? Well, obviously it's costing us a lot of human suffering and a reduction in the quality of life in this great state. But it's also costing us a lot of money, more than $6 billion every year, year on year, that we could be using for education and infrastructure and jobs creation and lots of other really wonderful things that we want to do. So it's a huge burden, it's a huge cost. We can't continue to sustain it, nor should we want to. I mean, we're too good for that.
That's
it's too
right.
good a state for that.
And just as you said, how we behave today and how we treat ourselves and our bodies and what we consume really will make an impact for the rest of our lives in terms of how we live.
It will.
You know, something that Healthier Tennessee encourages, of course, most Tennesseans to do, 3 main things that you all have as far as your platform is concerned, and that is you need to be eating nutritious food, you need to be physically active, and you need to cut the tobacco. Why focus on those 3 things?
Well, those 3 things are the greatest contributors to these chronic diseases that I've been talking about. Being inactive and being overweight and using tobacco directly correlates to having 1 or more of these life-threatening, serious chronic diseases. So we're very focused on changing those. Additionally, when we're more active, when we're eating a healthier diet, and when we're not using tobacco, we feel better. Life's better. And quality of life is better. And so even if we put aside for a minute the impact on chronic disease, the positive impact on just how we go through life is significant as well.
Sure. We talked a little bit before the program began, and you and I were mentioning the fact that, you know, this is your basically goal to have, you know, Tennesseans be healthier. But the nice thing is, you know, different cities across the state are doing the same thing individually. So the message is really being, you know, shouted from the rooftops for everyone to hear. So it's probably nice to be able to have those other different kind of, you know, government entities helping out with something like this.
Yes, and also community organizations and private sector organizations. We have more than 110 organizations and businesses and community groups that are our affiliates, our coalition partners in working on this all across the state. It is something that we face in every county in the state, and it is something that we have to work on in concert with lots of other people and on a local basis.
Okay, let's go back to the 3 things that we had just mentioned, the eating nutritious foods and staying physically active and putting down the cigarettes. What are some small steps, would you say, Mr. Johnson, for folks to, you know, really kind of combat the smoking, but then also to implement the good things of the good foods and getting out there and hitting the pavement in terms of walking or running? Right. How can they start small? And
that really is the key question. All of us know, I think, or at least most of us sure know, it's good for us, and we need to be more physically active and get a little more exercise. We need to eat a healthier diet and control our portions, and we sure know we don't need to be smoking tobacco. The question is not what we need to do, it's really how do we do it. And many of us have been frustrated about this and sort of given up before we started because we feel like we don't have time. It's going to be really complicated and difficult. It's probably maybe going to be expensive, and it's going to take a long time. And gosh, you know, I have all these reasons why I really can't do that. And I may not even know how to do it, even though I really have the desire to do it. If I ask you to completely change your life, do something really expensive, really difficult, it's going to take a long time, it's really complicated, you're probably going to say, no thank you, I don't think I can do that. But if I ask you to take some small steps, a few small starts, to find ways to be more active and to eat better and to not use tobacco, you're much more likely to say yes, assuming they don't take a lot of time. They're basically simple, and guess what? They're free. So we have designed tools and ways that we think people can take small starts, and that's literally what they're called, small starts, to begin to be more active, to eat better food, healthier food, control portions, not use tobacco. We put those on our website, healthiertn.com. You can go there and look at small starts and begin this process of saying, hey, I only have to do a few small things and keep doing them, and then do a few more, and then do a few more, and pretty soon I've changed my day a little bit, and then my whole life has changed. And it's become a habit. It's become the kind of way that I go through the world. So it's a really key message we want to try to get across, that you can start small, you can take small steps, and you can get big positive results from doing that.
Excellent. All right, Mr. Rick Johnson, we so appreciate your time today. And you'll definitely want to go ahead and check out some social media and an application that they've also developed on this great cause.
We have a great free app called Streaks for Small Starts, and that's at healthiertn.com too.
Right, excellent. Thank you so much for your time
Thank
today.
you. It's been a pleasure.
Did you know that even modest weight loss can provide big health benefits? According to the Centers for Disease Control and Prevention, if you are overweight, moderate weight loss of just 5 to 10% of your total body weight can help improve blood pressure and blood sugars. In addition to improving your health, maintaining a healthy weight loss can also improve energy levels, physical mobility, general mood, and self-confidence. We want to welcome now Sarah Neil Pilkinton, who is an outpatient nutrition education coordinator, very important title over at Williamson Medical Center. Thanks for sharing some time today with us.
Thank you for having me.
We really appreciate it. You know everything about what we're supposed to be eating, and you know what we put into our bodies is so important. So talk a little bit about the importance of good nutrition, please.
Well, good nutrition is important because it affects so many things about our bodies as far as maintaining a healthy weight. But the more that we learn about nutrition, the more we realize how much it helps prevent so many chronic diseases.
So tell us the types of foods maybe that we should be implementing every day into our diets.
Okay, so I like to think strive for 5. All right, so we're going to start with our lean proteins or lean meats, low-fat dairy or fat-free dairy, those fresh fruits, fresh vegetables, and what's really important are those whole grains as well.
A lot of people would probably say, you know, when I'm making out my grocery list on a weekly basis, I can't put those healthy foods down because I know they cost a lot. What would be your response to that?
I hear this a lot, and what I usually say is just like any other item in your family budget, you need to prioritize with what's important first. Specifically, those 5 things that I just listed, those are probably the most important items on your grocery list, okay? So budget for those first. And then if there's extra money left over, then maybe going for those foods that are not as nutritious. Another thing is, a lot of people don't realize this, but research actually has shown that healthy foods really are cheaper than those convenient food items. The problem is the education to know how to pick out those fresh fruits and vegetables, how to prepare them. And one of the things that I see most often is the lack of planning that those things require. You've got to make time to cut, peel, wash, cook, and that all takes time. The convenient fast foods, the nutrient poor foods, they're very grab and go, and they're easy to grab quickly when you haven't made a plan. Okay. The other thing is, I have a couple of examples I usually give for things. So compare a bag of potato chips to a bag of potatoes. They're both roughly about the same price, but which one is going to last longer? You're more than likely going to eat through that bag of potato chips pretty quickly, but that bag of potatoes is going to last a while, right?
Absolutely.
Think about an apple pie compared to a bag of apples. About the same price, but which will last longer and which is healthier? Instant oatmeal compared to old-fashioned rolled oats. You can spend about the same amount on each thing, but which one's going to give you the better nutrition and going to last longer?
And it seems like you can make so much more when you're talking about the bag of apples, the bag of potatoes.
Exactly.
I mean, you can be creative, implement the kids, get them involved with the recipes and that kind of thing. But
it all takes time, and it takes planning.
That's right. Let's also talk, if you don't mind, Sarah Neil, about the actual current nutritional guidelines. They seem so different from what I grew up with and what a lot of people remember.
I know. I remember the food pyramid.
Yes. On
the bottom where your grains, and you're supposed to have that for the majority of your food, working its way up to the fruits, the vegetables, the dairy and meats. So what we have today is the My Plate version. And the thing that I love about it is it helps people visualize what their plate should look like. Okay, with half of your plate being those fruits and vegetables, on the other half of your plate being those whole grains that we talked about, the lean proteins, and then maybe having a glass of milk or a cup of yogurt to the side.
That's great. And also talk a little bit about portion control too with those kind of things. Because when you talk about, you know, the nutritional guidelines and what we should be seeing on our plate, Obviously, you shouldn't see a large amount of it, too. I mean, I always give my kids more strawberries if they're still hungry after lunch, but you don't want to overfeed yourself at any meal, really.
Exactly. So with everything, choosing lean is typically going to be important, but then also portion sizes. Just because it's good for you doesn't mean you can have as much as you want.
Okay.
But I think first, maybe even just taking your plate and working towards getting those components of the plate lined up is a good place to start, and then work towards portions.
Very good. All right, recent news reports point to an overconsumption of salt in our diet nowadays. What are some things that we can do to keep salt out of our diet, or at least know how much we should have?
Okay, so first of all, let's start with how much should you have, because doing a lot of the things, they're not going to mean anything unless you know what your goals are.
Very true.
So first of all, what are your goals? For most Americans, your goal is less than 2,300 per day. Okay, and you can think and try to break that down, divided by 3 meals, and maybe leave you a little bit of reserve for snacks. Okay, now for adults who are over the age of 50, who have high blood pressure, kidney disease, or diabetes, you really should strive for less than 1,500 milligrams of sodium a day. So how do you do this? Choosing the most fresh fruits and vegetables is best. If you can't choose fresh, frozen without a sauce or a gravy also works well. As a last resort, you can choose a canned vegetable, but you really want to try to make sure you rinse those well, or choose one with no added salt.
So a lot of statistics recently now say that Tennesseans are inactive.
That's right, and you know, studies are showing that being inactive is just as dangerous for our health as smoking. I think that brings a lot of attention to inactivity, kind of really showing how important it is to get out there and be physically active.
Let's also talk about exercise and how that fits into lifestyle in general.
Okay, so I like to think of this as calories in, calories out. So the calories in are going to be the calories that you eat, and to maintain a healthy weight, you've got to burn off as much as you take in. So when we consume more than we burn off, that's what leads to weight gain. Okay, so that's where physical activity plays into balancing a healthy weight.
Yeah.
So in order to move that equation a little bit more, increase that physical activity so you can burn off more than you're taking in, and weight loss will result.
Yeah, and you have to keep that in mind, because it's not just about what you're serving up at every meal. It's also about what you're doing in addition to that.
Right, and I tell patients a lot of times when I see them who are overweight and they say, you know, I don't know why I'm overweight. I eat all the right foods. And then I quickly go to, well, are you exercising? And then we start talking about ways to increase exercise, to increase that metabolism, to balance out that equation a little bit better.
Sure. And body mass index, something else we have to keep in mind, BMI. A lot of people have heard of this before.
Mm-hmm. So what a BMI is, it's a number where we've calculated a height to weight ratio. Okay, and research has shown that the higher the BMI, typically the more body fat someone has.
Okay. The
lower the BMI, less body fat.
All right, so a lot of things to think about. Thank you so much for this great advice. We so appreciate your time today.
Thank you.
Did you know every year between 5 and 20% of Americans get the flu? That's according to the U.S. Department of Health and Human Services. For most people, the flu results in a few missed days of school or work. But every year, thousands of people die from flu and its complications. The best way to protect yourself and reduce your chance of getting the flu is to get a flu shot. According to the Centers for Disease Control and Prevention, everyone who is at least 6 months old should get the flu vaccine. The vaccine is especially important for people who have certain medical conditions, such as asthma, diabetes, or chronic lung disease, and for pregnant women, young children, and people 65 and older. We'd like to welcome Dr. Brent Coil, who is a family practitioner with Nashville Medical Group. We're so glad that you took some time out of your busy schedule to talk with us today.
Well, thank you for the invitation.
This is the time of year where you hear cold and flu season. Everybody is kind of in a tizzy over cold and flu season because you know it's coming. Somebody in your household may eventually get a cold or the flu. But explain what cold and flu season means to a doctor.
There is a certain seasonality to illnesses, and we do see many more respiratory illnesses. Most of them are caused by viruses, occur in the fall and the winter months, and that's when people tend to be indoors, and they are sicker because of it.
Sure. We've had some pretty frigid temperatures already for this season, so a lot of kids are staying inside, obviously sharing germs with each other. Is that really how it happens? Is that the majority of the reason why people get sick this time of year?
Yes, that's exactly how it happens. The virus is transmitted through direct contact, through the doorknobs or pens or the mouse on the computer, and then if you then touch your eyes or your nose or your face, that you infect yourself, and it's easily spread from person to person. That germ can stay alive on a surface for almost a day. Wow. Outside the body, so it can be a pretty hardy little virus.
Sure. And what types of viruses are currently most prevalent? Is it just cold and flu, or are there others that we should be aware of this time of year as well?
I think you see a lot of different viruses. Most of them manifest as what's commonly known as a cold, but you have the rhinoviruses and the coronaviruses. You hear about influenza virus, which causes a illness that most people are somewhat familiar with. But you have other ones such as RSV and para-influenza viruses as well.
You mentioned the fact that obviously people are touching doorknobs and touching other things and exposing some germs to objects that we all kind of end up touching. But how are these viruses transmitted besides something like that? Is it mainly through coughing and that type of thing?
Yes, there are several ways they can be transmitted. If you cough or sneeze, get the virus on your hands and then touch something, it will stay there. Or if you sneeze the respiratory droplets on to somebody else, they can then breathe those in and become infected as well.
Sure, and then it's airborne and everybody's sharing that. What can we do in our workplaces to kind of maintain good health? Because these viruses, as you said, are going to be prevalent. In the school, obviously kids, you know, have the hand sanitizer, they're encouraged to wash their hands, but in the workplace specifically, what can we do?
I think you follow the same recommendations that we would for children at a school. It's good to have a bottle of hand sanitizer at your desk. Hand washing with soap and warm water will also get rid of those viruses. And so we just want to make sure that we keep a clean environment and realize that the best way to prevent it is to avoid touching yourself in your hands through your face and eyes and infecting yourself.
Let's talk, Dr. Coil, about some of the symptoms that you will notice right away when you either have cold or flu. What are some of the things that will first appear?
A lot of times the first symptoms would be a sore throat, followed by congestion in the nose, runny nose, followed by a cough. If you have a fever, sometimes that would be more indicative of an influenza infection, but they're very similar kind of infections with similar symptoms.
I think a lot of parents would probably rush their children right away to the doctor.
Right.
But we as adults sometimes think we can tough something like this out. So when should we pick up the phone, call the doctor, knowing that it's probably a little bit more serious? Is it so many days that we should wait, or the way we feel?
I think it's probably a little bit of both. Typically a respiratory infection, virus, a cold is going to go away on its own in a week to 10 days. And it doesn't need any treatment, and there is not an antibiotic that we can give to make the cold go away faster. But if your cold is hanging on for 10 days or 2 weeks, or you're developing fever, it's probably time to think about getting to the doctor and having the check, see what's going on. If you're having problems with shortness of breath or problems breathing, then it would be another good reason to go be seen.
A lot of folks grab the first thing they can find on the store shelf in terms of just putting a Band-Aid on the problem, because it is in essence something like that. You know, you want immediate relief, so you're going to get something over the counter. We've also been told that sometimes an antibiotic, as you said, can't necessarily combat the common cold. But does it work on viral conditions, or is it strictly bacterial?
Antibiotic is strictly for bacterial infections, pneumonia, or maybe an ear infection in a child. It does not do anything for a viral infection. There's been no benefit. There are antivirals made specifically for things like influenza, but they're of no benefit in the common cold.
Also this time of year, we're talking about flu clinics. You see them pop up at a lot of different places, whether it be your pediatrician's office or a local pharmacy that's down the street. Should we be taking advantages of, you know, this being offered to us as the public?
I think flu vaccines are a wonderful benefit, and people should take advantage of that more than what they do. The flu vaccine is the best way to protect against the flu infection, and sometimes the vaccine is better in some years, and sometimes it's not as good for protection. But right now, that's the best protection that we have, and I would encourage everybody to take advantage of that.
Age range, obviously there is one in terms of, you know, I know small little babies cannot get the flu vaccine. But what about the elderly population? I know that we talk about that also, those folks being more at risk for something like this time of year. It could turn into pneumonia or something even more devastating.
And that is the population that we worry about, either the very young or the very old with complications from a flu infection. We like to vaccinate anybody that wants to. You're right, you cannot vaccinate children that are less than 6 months old, but anybody 6 months to 110 that would like a vaccination should probably get one.
Yeah, and this is something, again, that's usually available, not just if you don't have a prime care physician. You could go to a local, you know, pharmacy of some sort and be able to take advantage of something like this.
Right.
People who choose not to be vaccinated and try the home remedies, good thing, bad thing? I mean, I know that doctors are always going to say, get vaccinated, but what if you try to tough it out because you're thinking you're building your immune system in some way?
You know, and that may be okay in certain situations. Some people have a young, healthy immune system and they'd be fine getting through it. But others with lung disease, asthma, or emphysema, toughing it out is maybe not the best idea because they're set up to have a complication of pneumonia or a sinus infection or something secondary.
All right, and as far as prevention is concerned, what do we need to remember, things that we can do at home or at the office?
Try to get plenty of rest. As your immune system gets run down, that's when you're more at risk for infection. Being careful what you're touching and being healthy with good nutrition.
Yeah, you always have to remember those kind of things because I think everybody's on the go more or less this time of year too. As the holidays come around and we're all rushing around, that's something that we don't get enough of is sleep.
Exactly.
So it's a huge thing to be able to prevent any kind of infection coming on. Dr. Brent Coil, again, family practitioner, thank you so much for your time today.
Thank you.
We really appreciate it. Did you know you can reduce your risk of sharing cold and flu viruses with your coworkers? Try these 5 simple prevention strategies from WebMD. Call in sick when necessary. Cover your mouth and nose when you sneeze or cough. Wash your hands often. Avoid touching your eyes, nose, and mouth. And wipe down your desk and other common areas with disinfectant.